May is National Stroke Awareness Month. We have Dr. Shawn Smith from Intermountain Medical Center Neurosciences Institute. He's here to tell us more about it. We know that thousands of Americans suffer a stroke every year. And we want to talk a little bit about, I guess, knowing what to do if you see someone or if you yourself are having a stroke. Can you tell yourself if you're having one?
You can. You ought to be able to, at least sometimes. So the biggest thing if you think that you're having a stroke, I mean, the biggest thing to do is call 911 and get some emergency attention right away.
Yeah, time is of the essence,
Time
obviously.
is the most important thing. We know that about 32,000 brain cells a second die during a stroke. And we have a lot of tools nowadays that we can use to pull clot out of a vessel or do other kinds of acute interventions to try to abort a stroke.
Okay. Now on the screen here, stroke facts. 130,000 Americans killed every year by strokes. Every 40 seconds someone has one. Just some of the other numbers there. And okay, are most strokes debilitating, or what is the recovery like nowadays?
So there's folks that can have marked improvement from stroke. You know, when we think about strokes, the first thing is to try to treat it acutely, right, when it first happens. And there's some time frames that we can use. We talk about within the first 3 hours or the first 4.5 hours, and now we can get out even further. And so that's sort of the first step, is treating it acutely. But once a stroke happens and you get into kind of that subacute phase, then people can have marked improvement. It really just depends on where the stroke is and how big it is.
Okay, so the acronym FAST. Let's go over that really fast and what you can do if you need to help someone get through this.
Okay. Yeah, so B FAST is this acronym, and they talk about if you see changes with balance. E stands for eyes, so if you have a change in your vision, double vision, or you lose sight in one place or another. If you have weakness in your face, weakness in your arms, if your speech or your language is abnormal. And then the T in B FAST is for time, because time, like we said, is of the essence.
Yeah. Well, Dr. Smith, thank you very much. Some life-saving information there, so we appreciate you coming by.
Thank you.